Our next speaker is Dr. Daksha Shah, who is an Executive Health Officer, Public Health Department, BMC. She has done MBBS, DPH, WHO Fellow. She is a Fulbright Scholar and Mumfrey Fellow, Tulane University. So over 28 years of experience in BMC, worked in all national programs. And during the COVID, she played key role in creating awareness of NCDs and initiated community screening for hypertension and diabetes. She has played pivotal role in developing and comprehensive TB-free Mumbai plan, a roadmap for 5 years. She has revamped BMC's PPP policy for dialysis, and she has published several papers in peer-reviewed journals. Please welcome Dr. Daksha Shah.
All the senior colleagues and all the office bearers of GPA and my dear friends. I can see a lot of familiar faces, Dr. Smita Brahmbhatt, Dr. Kenya, Dr. Tushar Shah, a lot of colleagues from BMC. I think at the outset, I would first like to thank GPA for inviting me today, a public health person. It's like coming back home. I remember 25 to 30 years back, I became the member of GPA. Dr. Brahmbhatt, I think, made me the member of GPA. And I used to attend all the GPA conferences. And I think almost for 5 years, I attended. And in fact, sir, Dr. Merchant, I learned a lot of things from you. You used to take those ECG classes. And I learned ECGs from your, CME programs, and I used to apply those in the hospitals when I used to work in casualty. So GPA has been always instrumental in providing the academic fees to its members. And in fact, I learned a lot of things. My initial clinical informations and whatever I learned is more from GPAs than from the MBBS. So with this, I really thank GPA for inviting me today. It's a great pleasure and privilege for me to be here with this morning. I was just wondering, and I was going through the agenda. The agenda has a lot of clinical aspects. In fact, you also have artificial intelligence. Then you have criminal, some topics on criminal things, ENT, dermat, psychiatry, and so on and so forth. And I was just wondering, universal health coverage, यानी लोगों को information होगा, कुछ उनको boring तो नहीं लगेगा ना. But still, I was just talking to some of them. They said, no, it's a very important topic. Yes, it is, because you all are the primary healthcare physician. And believe me, after COVID, world over, the primary health care is gaining more and more importance because the focus of the governments, the focus of world over, the WHO, is in strengthening the primary health care. And GPs being the first point of care in the community and the contact with the GPs, with the patients, it's more or less important to know the universal health coverage and how is it expanding and what governments are doing to do the universal health coverage. So with this, I just introduce the topic with my first slide. Definition, it means that it is the people have access to the full range of quality of healthcare services. I'm sure you all are providing quality of care. And to ensure the healthy lives and promote the well-being is the SDGs, Sustainable Development Goals. 3.8, it calls upon the countries to ensure that there is no financial risk or there is a financial risk protections in terms of giving the more access to the quality essential healthcare services. So if you look at the country, when we are charting a national health policy, lot of principle has been now incorporated while writing down the national health policy, and some of those principles are written into the universal health coverage. Now these are some of the aspects of universal health coverage that any healthcare system has, basic building blocks. The building blocks of the healthcare system are, number one, of course, the healthcare infrastructures, that is the hospitals, health centers, and so on. It's people, that is HR. The third is your logistics, drugs, and so on and so forth. And the fourth and most important is the leadership and governance. You need to create people who can lead the health system. People like you, the GPAs, the conferences, this platform, because you are bringing people together to think over what next we can do as a community or as a people who can look after the primary health care. So with this, if you look at the progress of universal health coverage in the country, since 1948, I'm sure you all know Alma-Ata Declaration of 1978, 1981, Health for All concept came. Then 2008, again the Alma Ata Declaration for need of revitalizing the primary healthcare. Sustainable Development Goals in 2015, and in 2018, again marked the 40th anniversary that reinforced the pivotal role of primary healthcare. And needless to say that you all are giving the primary healthcare to the citizens, whether it is in Mumbai or whether it is in the country. The GPs play a very pivotal role in the primary healthcare. Now going further, what are the key policy principles? One is equity, affordability, universality, inclusiveness, patient-centered care. I was just listening to Dr. Amdekar, an excellent case presentations, and I'm sure that day to day, we have so many cases, where there is confusion, but still with this, we provide care with a quality ingredient into it, and we exercise best of our knowledge and best of our, resources to make sure that this person who is in front of us is being treated to the best of our knowledge. Accountability, inclusive partnerships. So these are some of the principles which, when a government plans a policy, is being taken into consideration. Of course, nothing can happen without a health budget. If you see, traditionally, India has been known that we do not provide much budget for the health, but of late, you must have heard about Honorable Prime Minister now talking about our, PMJY Yojana. I'm sure I'll come to it in a bit. So, Honorable Prime Minister is now talking about the Yoga Day, the Millet Year, and so on and so forth. But if you look at the health budget, there is a now commitment by the Health Ministry that 2.5% of the GDP will be allotted to the health. And increasingly, particularly in BMC, in last 5 years, I've seen there is more and more allotment of the health budget amongst the entire health budget of the BMC. So this is how the commitment of the government is to increase the health budget, and so that you can reach and you can provide and fulfill the vision of universal health coverage. Mumbai, we all know, is a population of 1.5 crore है. Daytime में तो सारे आजू-बाजू के corporations के भी लोग आते हैं. But the population is very, very vulnerable because of the slum population. 50% lives in slum and slum-like areas. Not only that, we have a lot of migrant population. Like yesterday, I was going through our COVID ka list. Like right now, we know that JN1 is so prevalent in, the country. Even Mumbai has some JN1 cases. I'll be declaring today evening. But when we take the history, we found that there are a lot of migrants also is in the city. And it's a challenge to provide the healthcare to the migrant population, because our health system, which is there in Mumbai, we go house to house in each and every slum area of Mumbai. So these are some of the areas, and we have 24 wards. We have the largest slum population density. We have a density of 29 to 28,000 people per square kilometer. This is the highest in the country. No other cities has so much of health population, and obviously, these are all the ingredients that we see the communicable disease spread, the TB, COVID, because हमारे पास इतना population density है कि these diseases they spread very, very easily. Now, these are some of the health infrastructure which BMC is providing. Of course, while providing the healthcare infrastructure and the healthcare services, we collaborate with you all. We collaborate with all the consultants, the private sector, NGOs, corporate, and so on and so forth. Right now, we have, of course, 5 teaching hospitals, 16 peripheral hospitals, 30 maternity homes, special hospitals. What's important is we have now is a HBT clinic. We have developed this Hindu Hriday Samrat Balasaheb Thackeray Apla Davakhana. We have developed around 174 such Apla Davakhanas. We have polyclinics. So far, we had a primary, secondary, and tertiary care. So primary care, of course, deals with all the basic, infections control, plus communicable disease control, plus family welfare and immunization and so forth. But now we have a polyclinic layer. So we have 28 polyclinics in Mumbai. Then we have PPP facilities also, and we also collaborate with entire private sector. You all know we have around 1,400 plus small or big hospitals in Mumbai, plus 25,000 plus GPs. I'm sure that we have a huge strength here, right now here today. So all the private practitioners, we want to reach out to all of you through this kind of dialogue, that how best we can partner and we can collaborate with the private sector and provide that basic good quality healthcare to the citizens of Mumbai. Umbrella of services, it's not just the curative. Mind you, your role is very important in preventive and promotive care as well. In fact, 50%, if you focus on your preventive and promotive aspect, half of the things is done. You don't have to give medicine in a lot of cases. So preventive aspect, as you all know, we are providing immunization services, family planning services. We give house-to-house surveys. We do malaria test, you know, our surveillance workers, they go house to house and do the malaria test.
Excuse me, ma'am.
Plus,
2 minutes more.
okay, I'll just finish fast. Give me 5 minutes, okay? TB and leprosy. We are also doing a lot of work in TB and leprosy. We have rolled out a TB map for Mumbai, and private physicians are all partners in our TB program. This is some of the aspects. You must have heard about the yoga centers in Mumbai. Just look around. There are 130 yoga centers where you can get free yoga sessions. We have around 5,000 to 6,000 citizens doing yoga free of cost in Mumbai every day. So we have also established that the NCD is getting now more and more focus. As we all know, 25% of deaths happens because of heart disease and the heart ailments, diabetes, hypertension, and cancer. So the government is now putting more and more focus on NCDs. Of course, the communicable disease challenge is already there, but NCDs are more now important. Now, I want to now focus, of course, I've already told you about the Apla Dawakhana. This is some of the pictures. We've established these Apla Dawakhanas, and these are the services. We are giving free of cost diagnostic services in Apla Dawakhana, so all the blood tests are available. Through the vouchers, we'll be introducing soon the X-ray facilities, CT, MRI, USG, and mammography. We are already working on the tenders, so now we'll be doing that also, dental services. And dietitians are also going in my clinics. So in every BMC dispensary, every 15 days, one dietitian visits, and we also provide free of cost counseling for the nutrition for all these patients who visits us. Under the NCDs, we have developed NCD corners, screening of each and every individual who is walking into our clinic, 30 plus, we get screened for random sugar as well as the blood pressure. House to house survey, our ASHAs, CHVs are also taking BP and referring these people who are suspects to our nearby dispensaries. Viksit Bharat Sankalp Yojana, you can see the Union Minister over there. Now, under this, we are going door to door and we are having these camps and vans who we are promoting the Ayushman Bharat Yojana. You should know about this, rupees 5 lakh cover for every individual in the community who are poor. We are giving the health card. And this has been distributed to more than now 1 lakh beneficiaries in the city. Also the Abha ID. This is like a DigiLocker. So you create a health record of an individual. So you can, whether you go to a public sector or you go to a private sector, your all health records remains there. So Abha ID, Abha number for every citizens is been also promoted by Government of India. Healthcare professional registries and health facility registry. So this is a ABDM, Digital Health Mission of Government of India. And maybe 5 years down the line, we will have, every one of us will be having an Abha ID. And through this, you can access whatever services and schemes of Government of India is there through these IDs. Then we have TB care. Some of you may be members. We are providing free X-ray vouchers. We are providing free CBNet test. We are also providing free treatment under TB program and the follow-up of the patients. If a private physician wants, he can get all the follow-up of the patients of the TB through our NGO partners who are now collaborating between the public sector and the private sector. This is one of its kind of program, PPSA. It is now rolled out in 22 states of the country. So under PPSA, now we have registered more than 30,000 TB patients who are taking care into private sector, but registered and supported through the public sector. So it is like a win-win situation. People remain, the patient remains in the private sector, but all the facilities and most of the things are given by the public sector. So this is one of its kind. The project is supported by the Government of India funds. Public-private partnerships, dialysis centers we are starting. So there are many other programs which we are already doing under PPP policies. How a general practitioner can contribute. Number one, all our Thakre Dawakhanas, there are 20,000 population, one Dawakhana is there. All the youngsters, we are promoting that you be part of this Dawakhana. So we are paying somewhere around 70 to 80,000 salary for all the doctors who join our Dawakhanas. Plus, there is an incentive-based, performance-based incentive, so you can earn up to 1,10,000. Our age limit for the Dawakhana is 72 years. So even if you are old, you know, you can get into Dawakhanas. There are 2 shifts available into our dispensaries. Now, these are 190 dispensary plus 150, so we have around 350 Apla Dawakhanas, which is now there into Mumbai. Plus community engagement and of course the measles outbreak and so many things you are already supporting. promoting the health wellness. That is putting the posters regarding TB, regarding prevention, regarding immunization in your clinics. So these are the activities you can help the BMC and the government for doing, promoting the health. Disease notifications, you all are notifying the disease of dengue, lepto, malaria, etc. Now, of course, the COVID, so we have maximum registrations or the cases which we declare nowadays. Health education and promotion is part of our all the general practitioners. Gatekeepers, you are the gatekeepers of the health system, because the patients seek care first to your clinics. So it's very important to guide the patients properly. If he's not affording, send to the BMC Dawakhanas or the hospitals right away, especially if it is TB or leprosy or any other such serious disease, so that he do not default. We do not create more resistant patients. That's more important. So National Health Services in UK, I know the GPs are the first gatekeepers into the UK health services, and the similar things we are thinking how we can involve the private practitioners more and more into our healthcare. And continuum of healthcare, chronic disease, we all know diabetes, hypertension, it's a silent killer. It's a silent pandemic which we are going to face in very near future. 100 million diabetes in India, already we know 100 million pre-diabetes in the country already there. So how do you prevent these pre-diabetic to convert into diabetic? So there comes our role of prevention and promoting more healthy choices and promoting more of diet and exercises in the patient routines. Here plays a very important role of all of you, including government, including BMC, including all the private partners and corporates. So supplementary government efforts, empowering healthcare providers, referring patients, community participation, and sharing the best practices. I'm very glad that GP has taken up, I think there is one session after the lunch regarding what is the general practitioners can do. I think Ranjini, you are talking on it. Yeah. So this kind of interactions is very important, and if anything else is there, we are always there to guide. If there are new guidelines, treatment guidelines, we are always there. Please feel free to please consult us and our medical officer of health and our nearby health centers. So with this, I thank all of you. We have a long way to go. We have to eliminate TB by 2025 probably. I think it might get extended. Leprosy, zero transmission. These are the national targets, 2027. Measles elimination by 2023. We have already crossed that. I think we need to work on better. Rabies eliminations, and of course, One Health approach. So with these targets in mind, I invite and I thank all of you to be part of the primary healthcare system, and thank you very much for having me here.
Thank you, Dr. Daksha, for the informative talk. I request Dr. Rajendra Trivedi to felicitate Dr. Daksha Shah.